Are you aware of the unexpected side effects and health risks linked to blueberry consumption? In today's video, we'll explore the possible dangers of this apparently safe fruit before you add them into your morning smoothie. Are blueberries truly safe for everyone, or are there certain groups of people who should avoid them entirely? What are the researchers saying about it? Blueberries are constantly being touted as a superfood packed with antioxidants and other nutrients. These little wonders may help lower blood pressure, prevent heart disease, improve memory, aid in exercise recovery, and more. But unfortunately, for some people, consuming blueberries can actually be dangerous. Curious if you might be affected? Keep watching to find out. Before we dive in, we'd like to know about your experience. Have you incorporated blueberries into your diet? If so, how? Do you consume the fruit fresh, drink the juice, or include it in smoothies? Share your experiences and opinions in the comments below. If you have any of the following 5 health problems that I'm going to share with you, it's best to avoid blueberries. Watch until the end because if you belong to the last group, eating blueberries could be fatal. 1. Individuals with bleeding disorders or taking blood thinners. The first group that needs to watch out for blueberries is people with blood clotting disorders or who take blood thinners. Elizabeth, a 60-year-old lady who was taking warfarin, a blood-thinning medication, had no idea that her beloved daily blueberry smoothie could pose a problem. Blueberries are high in vitamin K, which plays a key role in blood clotting. A cup of blueberries has about 24% of the recommended daily intake of vitamin K. For someone like Elizabeth on blood thinners like warfarin, suddenly eating a lot of blueberries could interfere with their medication and increase their risk of bleeding. It's not that people on blood thinners can never eat blueberries, but they need to be careful about sudden changes in their vitamin K intake. If you're on blood thinners and want to start eating more blueberries, talk to your doctor first. They may need to adjust your medication dosage. 2. Individuals allergic to salicylates compound. Jennifer, a 35-year-old lady, had never eaten blueberries before, but one day she decided to buy some at the supermarket and make juice from them at home. After drinking the blueberry juice, she began to experience side effects such as itching, stomach pain, diarrhea, nausea, and vomiting. Worried, Jennifer went to the doctor and underwent tests to identify the cause of these symptoms. The results revealed that she was allergic to one of the main components of the fruit, salicylates. Salicylates are natural compounds found in many plants, including blueberries. Most people can eat salicylates without any problem. Some people are sensitive to them and can experience symptoms like headaches, stomach pain, or itching when they eat foods high in salicylates. Blueberry allergies can cause symptoms ranging from mild, like itching in the mouth, to severe, like anaphylaxis. Blueberries are actually quite high in salicylates compared to many other foods. They contain about 28 milligrams of salicylates per 100 grams. For comparison, apples have about 2.8 milligrams per 100 grams. If you know you're sensitive to salicylates like Jennifer, you may need to limit or avoid blueberries. If you're not sure but suspect you might have a sensitivity, pay attention to how you feel after eating blueberries. If you consistently notice symptoms, it might be worth talking to a doctor or trying an elimination diet, so it's worth being cautious when trying blueberries for the first time. 3. People with gastrointestinal disease. Blueberries are high in fiber, which is generally a good thing. But for people with conditions like irritable bowel syndrome or inflammatory bowel disease, too much fiber can sometimes exacerbate symptoms. Blueberries also contain fructose, a type of sugar that some people have trouble digesting. If you have fructose malabsorption, eating a lot of blueberries could lead to gas, bloating, and diarrhea. Again, this doesn't mean everyone with digestive issues needs to completely avoid blueberries. But if you have a sensitive stomach, you might want to start with small portions and see how you tolerate them. 4. People taking certain medications. The 6th and final group that should be wary of blueberries is people taking certain medications. We already talked about blood thinners, but there are other medications that can interact with compounds in blueberries. Blueberries may interact with drugs that are changed by the liver. Blueberries contain compounds that can affect how quickly the liver breaks down certain medications. This could potentially lead to higher or lower levels of these drugs in your body. Some specific types of drugs that might interact with blueberries include certain antidepressants, beta blockers, and non-steroidal anti-inflammatory drugs. If you're on any of these medications and want to start eating a lot more blueberries than usual, it's worth checking with your doctor or pharmacist first. 5 individuals with a history of kidney stones. Charlotte, with her history of kidney stones, found out the hard way that those delicious blueberries pack oxalates, which can lead to more stone formation. Blueberries are packed with health benefits, but if you're prone to kidney stones, you might want to enjoy them in moderation. Fruits like strawberries, blueberries, and raspberries contain high levels of oxalate, which can speed up the formation of kidney stones. A study published in the American Journal of Physiology highlights that to prevent calcium oxalate stones, it is recommended that patients stay well hydrated, steer clear of oxalate-rich foods, and ensure they get enough calcium. So while they're delicious and nutritious, it's best to be cautious and not overindulge if you're concerned about kidney stones. If you're dealing with kidney stones, it's a good idea to limit your berry intake. Stay healthy and take care. Now, after learning all this, you might be thinking that blueberries sound pretty dangerous, right? But it's important to keep things in perspective. For the vast majority of people, blueberries are still a healthy food. All these potential issues are relatively rare. The key is to be aware of your own health situation and any risk factors you might have. If you fall into one of these 5 groups, it doesn't necessarily mean you need to cut blueberries out of your diet entirely. It just means you should be more cautious and potentially talk to a healthcare provider about how blueberries fit into your diet. So it's also worth noting that many of these potential issues aren't unique to blueberries. They apply to other foods as well. The vitamin K issue, for instance, applies to all leafy green vegetables. The salicylate issue applies to many fruits and vegetables. The fiber issue applies to most high-fiber foods. What makes blueberries stand out is that they hit on several of these issues at once. They're high in vitamin K, high in salicylates, high in fiber, and contain compounds that can interact with certain medications. It's this combination that makes them potentially problematic for a wider range of people than many other foods. But for most people, the benefits of blueberries still outweigh the potential risks. Blueberries are rich in antioxidants, particularly a type called anthocyanins. These compounds have been linked to a range of health benefits, including improved heart health, better brain function, and potentially even cancer prevention. Blueberries are also a good source of vitamin C, manganese, and dietary fiber. They're relatively low in calories and have a low glycemic index, which means they don't cause rapid spikes in blood sugar for most people. So what's the takeaway from all this? Should you be afraid of blueberries? For most people, the answer is no. If you've been eating blueberries without any problems, you can probably continue to do so. The potential issues we've discussed are relatively rare. This doesn't mean you need to cut blueberries out of your diet entirely, but you might want to. Start with small portions and see how you tolerate them. Be aware of how many blueberries you're eating and how often. Pay attention to any symptoms you experience after eating blueberries. Talk to your doctor or a registered dietitian about how blueberries fit into your diet. It's also worth remembering that there's no single food that's essential for good health. If you do need to limit or avoid blueberries, there are plenty of other fruits and vegetables that can provide similar nutrients. It's easy to get caught up in the idea of superfoods, or to think that if a food is healthy, more must always be better. But nutrition is complex and individual. What's healthy for one person might not be ideal for another. Until we get to that point, the best approach is to be aware of your own health situation, pay attention to how different foods make you feel, and don't be afraid to question even commonly accepted nutritional wisdom. Next time you're at the grocery store eyeing that pint of blueberries, take a second to think if they're really your best pick. Just remember, nutrition isn't a one-size-fits-all deal. The trick is figuring out what works best for you. If you found this video helpful, please type yes in the comments below. Also, don't forget to like, subscribe to the channel, and turn on notifications so you won't miss our next videos. Share it with your friends and family so everyone can use blueberries safely and enjoy its benefits. Your likes and comments really keep us going. They show us what you want to see more of. And before you go, take a moment to check out these 2 recommended videos. We think you'll really enjoy them. Thank you for watching. Have an awesome day and keep healthy, my friends. Bye.